If you've suffered an ankle sprain, one of the most common injuries in all of sports, we want to show you some exercises to get better, hopefully on your own. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, here with my friend and physical therapist, Yves Gege. Ankle sprains are the most common injury statistically in sports like football, basketball, soccer, not to mention all the weekend warriors, all the people who just love to exercise. You're running along, step awkwardly, and roll your foot, or you land awkwardly and roll your ankle. What can you do to get over that, short of going into the doctor and getting x-rays and all that kind of stuff, which you might need, but are there some simple things that you might be able to do first? Let's see what Yves has to suggest.
So you get that initial ankle sprain, right? It's going to be a little bit swollen, it's going to be a little bit inflamed. So by far the first thing that we tell people to do is to get a little bit of compression, a little bit of elevation, and be cautious with the weight bearing to let that thing heal.
Yeah, that makes sense.
Yeah, but as soon as that healing starts to happen and there's not as much swelling, we want to work on getting range of motion and getting some movement back in the ankle as early as possible to make sure that you're getting back on the field, getting back to walking as quickly as possible. So that's the first exercise we're going to go through. All right. So first one, we're just going to pretend this is a chair. So we're just going to have a seat in the chair. We're going to cross one leg over the other.
Okay.
This is pretty easy for you to do at home. You're going to grab the outside of your foot.
Okay.
And then you're going to pull up towards the ceiling gently, and you should feel a stretch just on the outside of your ankle, kind of in that tender sore area. You want to be pretty cautious with this. You want to go slowly, and as soon as you start to feel a little bit of stretch and pain, you're going to stop and you're going to hold it there anywhere from 30 seconds to a minute.
Yeah, almost all ankle sprains are going to be injuries to the ligaments on the outside of your ankle. And so that's why that makes sense that you would do exercises to work that side. And you can actually really feel that. That's really interesting. Something you go just where you feel tightness, but you don't, and slow, steady movements.
Right.
Okay,
I mean,
that makes sense.
You don't want to push it too far. The tendon itself still needs time to heal, right?
Okay.
You know this, we got to respect that healing time, but it's a great way to start getting movement back early. So the second thing, after we've gotten some movement back, and we know this happens a lot after swelling and after these injuries, is that some of our balance, or if you want to use a fancy term, proprioception, is a little bit hindered and needs to get worked back, right? So we want to make sure we start working our balance again. So first thing we're going to do, super easy exercise. Believe it or not, you know when I tell my patients to do this? When they're brushing their teeth.
Oh, that makes sense.
Super easy time, right? So the whole time you're brushing your teeth, try this exercise. You can do it more throughout the day, but it's a great time to do it. So you're just going to stand on one leg, bring the other leg up. Doesn't matter to bring it forward, back, as long as it's off of the ground, and you're going to hold that for as long as you can. It's pretty normal to see the ankle shaking left to right. Those are called ankle strategies, perfectly normal. If it's painful, maybe hold on to something at first,
that makes sense,
right?
yeah.
And then work your way to not holding anything. Doing that anywhere from a minute, sometimes longer, depends how long you brush your teeth. But holding that and starting to work those muscles should be great.
Well, and that makes a lot of sense too, because one of the challenges that I see is with athletes trying to get back to sports, it's been 3 weeks, 2, 4 weeks, whatever it's been, is that, the ankle's got good motion, it's got good strength, but they don't feel confident planting their foot and changing direction. And that's why what he's talking about with the balance and proprioception is so important. But time alone is not going to really do that much to get it back. You actually have to work to restore that.
Yeah, you need to work that system. If I'm going to cut directions quickly, my ankle needs to know what it feels like to be on one leg first before I do that. And sometimes it's a step that a lot of people skip.
And if you're getting better but not getting over the hump, you might think about working with a physical therapist like Yves, because he can not only do things like that, but then they can start putting you on sliding boards and do fancier ways to rebuild that balance and proprioception that really can speed up your recovery and return to sports. If you've suffered an ankle sprain, and I know that a lot of you out there have because it's so common, try these simple exercises out. Hopefully it gets you better in a week or 2 or 3 or 4 weeks. If you're not making much progress, see a physical therapist, go see an orthopedic surgeon to make sure it's not something bad. If you want more information on ankle sprains, click the videos below. You'll also find links to Yves' social media, all kinds of great physical therapy information. Make sure to subscribe to our videos. You'll get lots of great sports medicine information. Thank you so much for watching, and we look forward to seeing you right here next time.